Hello, today we're going to be doing medication reconciliation for our patient, Jack-O-Lantern. Here are his labs and vital signs, and this is Mr. Lantern's MAR. So the purpose of medication reconciliation is that we can verify Mr. Lantern's home medications against the MAR of medications that his doctor has prescribed. So at home, Mr. Lantern was taking hydrochlorothiazide and lisinopril for his hypertension. It states here that he has been out of it for a couple days. That's part of the reason he's been admitted. He last took them 3 days ago. So the doctor has ordered those medications in addition to ordering heparin 5,000 units subcutaneously, hydromorphone 2 milligrams intramuscularly, and a tuberculin skin test. So there are no omissions or duplications, and so the medication reconciliation for his medications is good to go. Mr. Lantern has 6 rights of patients that are his patient's right, and so today we'll be making sure that we have the right patient, Mr. Lantern, the right drug, the right dose, the right route, and the right time to be given these medications. After we're done giving them, we will document everything that we've done to complete his 6 rights. So that completes our medication reconciliation, and we will now move to the first medication check, which will be done at the med cart, followed by our second check, which we will do as we gather our supplies and prepare and draw up our medications. And then the third medication check will be at the patient's bedside as we are explaining and giving the medications. So this is the first medication check. So first on Mr. Lantern's MAR, we have hydrochlorothiazide, 25 milligrams to be given orally in a 25 milligram tab, and it expires 6/23/2020. And here we have hydrochlorothiazide, 25 milligrams in 1 tab, expires 6/23/2020. Next we have on the MAR, lisinopril, 20 milligrams per tablet, expires 5/26/2020. Here we have lisinopril, 20 milligrams per tablet, expires 5/26/2020. Next, on his ordered medications, we have heparin. So we have 5,000 units per milliliter to be given subcutaneously, expires 8/12/2020. Here we have heparin, 5,000 units per milliliter to be given subcutaneously. It expires 8/12/2020. Next we have hydromorphone, 2 milligrams per milliliter, expires 5/26/2020. Here we have hydromorphone, 2 milligrams per milliliter to be given intramuscularly, expires 5/26/2020. Next we'll be giving a tuberculin skin test. It is ordered at 5 TU per 0.1 milliliters to be given intradermally, and it expires 6/23/2020. Here we have the tuberculin skin test, 5 TU per 0.1 milliliter to be given intradermally, and it expires 6/23/2020. So we have all the correct medications and the correct amounts. This completes the first med check. We'll now go to the second medication check, where we will again compare the MAR to the medications we have on hand. We will gather the supplies, and we will prepare them to safely transport to the patient's room. So we'll go ahead and wash our hands before we start this second check, and then we will verify all our meds again. So we have first on Mr. Lantern's MAR is hydrochlorothiazide, 25 milligrams per tablet, expires 6/23/2020. Here we have hydrochlorothiazide, 25 milligrams per tablet, expires 6/23/2020. Next on his MAR, we have lisinopril, 20 milligrams per tablet, expires 5/26/2020. And here we have lisinopril, 20 milligrams per tablet, expires 5/26/2020. Next on the MAR, we have the heparin. It comes in it's been ordered at 5,000 units per milliliter to be given subcutaneously, It expires 8/12/2020. Here we have heparin, 5,000 units per milliliter to be given subcutaneously. It expires 8/12/2020. Next we have the hydromorphone, 2 milligrams per milliliter to be given intramuscularly. It expires 5/26/2020. Here we have hydromorphone, 2 milligrams per milliliter to be given intramuscularly. Expires 5/26/2020. Next we have the tuberculin skin test, 5 TU per 0.1 milliliter to be given intradermally. It expires 6/23/2020. Here we have the tuberculin skin test, 5 TU per 0.1 milliliter to be given intradermally, and it expires 6/23/2020. So now that we have verified those medications, we will gather the supplies for each medication. So first, for our hydrochlorothiazide, it will be given orally, so we need a medication souffle cup. Next, for our lisinopril, it's also in tablet form. It will be given orally, so we'll put it in the medication souffle cup. Next on our list is the heparin, 5,000 units. And so for the heparin, this is a high alert drug, so we will get a second nurse check here. We have our TB syringe that we will be using for heparin and an alcohol swab to clean the top of the heparin. Next, for our supplies, we have the hydromorphone. We're going to need an alcohol swab to break it. Then we will need an 18 gauge filtered needle. And then we will switch that to a 22 gauge 1.5 inch needle, and we will use a 3 milliliter syringe to draw up the hydromorphone. For the tuberculin skin test, we will be using a TB syringe, and we will also need a alcohol swab, as this is a multi-use vial, and we will want to clean that. We will also use our tape and pen to label all of our medications as we prepare them. Now we will prepare the medications that are needed. So our first medication that we're going to prepare is our hydrochlorothiazide. We will place that in the souffle cup and put it on the clipboard for transport. Next we have our lisinopril, which is also a tablet. We'll place that in the souffle cup and put it on the clipboard. For our heparin, we will get our TB syringe ready. We will wipe the top of the vial, and we're going to be using a TB syringe. We're going to be drawing up 1 milliliter, so we will go ahead and inject that in the vial and draw up 1 milliliter of heparin. And this is before we pull it out, where we would get a second nurse check to show that we have 1 milliliter of heparin. It's good, so we can pull that out, and we will recap this needle. Then we will label the top up here with our tape, and we will add on here that we have heparin, 5,000 units per milliliter, and we will put that on our cart so it will be prepared to transport. Okay, next we're going to draw up the hydromorphone, and for this we will have an alcohol swab, and we're not going to demonstrate today, but we would take the alcohol swab and break the ampoule away from us and away from anyone else and place it directly into the sharps container. We will be drawing up from this today to represent the hydromorphone. So for the hydromorphone, we're going to use a 3 milliliter syringe, and we're going to start with a filtered needle to make sure that we don't draw up any potential glass that could have gotten into the medication when we broke the ampoule. So we have our 18 gauge filtered needle. We'll inject that in. And we're going to do 2 milligrams per milliliter. So we're going to draw up 1 milliliter of medication. And then we will carefully recap our filtered needle. Then we can switch our filtered needle, open our 22 gauge 1.5 inch needle without touching the top. We will add this to our 3 milliliter syringe, and then we will label the top of this. This is our hydromorphone, and we have 2 milligrams per milliliter. We will set that on our clipboard to prepare for transport. Okay, next we have, we're going to prepare for the tuberculin skin test. And for the tuberculin skin test, this is often in a multi-use vial, so we will swab the top. And because we will only be drawing up 0.1 milliliters, we will first inject 0.1 milliliters of air into the vial. Now that we've injected that, we can draw up 0.1 milliliters for our TB skin test. We will recap this needle and label the top of the needle that this is our TB skin test. And we have 5 TU per 0.1 milliliter. And we will place that on the clipboard so that we can get that safely to our patient. So we'll move these out of our way. Okay, now we want to make sure that our patient, we've drawn up these medications, but we want to make sure that all of their vital signs and labs are in a safe range to be able to administer these medications. So first, we have our hydrochlorothiazide, and this is a potassium wasting diuretic. And so that means 2 things. We need to check Mr. Lantern's potassium level. It's currently at a 4.2, which is in a safe range for potassium. The range is 3.5 to 5, so he is okay on his potassium level. Hydrochlorothiazide also holds on to calcium in the body, and so we want to make sure he doesn't have too much calcium, and his level of calcium is currently at an 8.4, which is a safe range for calcium. So he is safe to take his hydrochlorothiazide. For his lisinopril, he's taking this for high blood pressure, but it can also decrease the blood pressure. So we want to check a couple of things here. We're going to check his blood pressure. It's currently at 172/94, and we're going to check his pulse rate, and it is at 90. So that is a safe range to take his lisinopril. Mr. Lantern's heparin, we would want to check his platelet count, and his labs for platelets came back at 129,000, which is a safe range. We would hold if it was less than 100,000. We also want to check his PTT. His value came back at 37, which for a patient who is taking heparin, the safe range is 30 to 70 up to 85, so that is a safe range to administer heparin. For the hydromorphone, we would first want to check Mr. Lantern's pain, location, type, and level. And he is reporting it is at an 8 with a low back throb and burning sensation. So that qualifies for hydromorphone, as it needs to be severe, moderate to severe pain to give that. We also want to check with hydromorphone that we make sure that his respirations are above 10, and Mr. Lantern is at 20, so that is a safe range for respirations. We would want to check that his apical pulse is above 60, and he is at 90. And we would want to check his blood pressure to make sure the systolic blood pressure is above 100. And his blood pressure is currently 172/94, so those are all safe ranges to administer hydromorphone. For the tuberculin skin test, we would want to ask Mr. Lantern if he had ever had a positive TB test, and if he'd ever come in contact with anyone with tuberculosis. So we will verify those before we give the TB test, but he is safe to give that test. So this completes our second medication check. We will now take our cart. We have all of our medications, and we will safely transport them to our patient. This is the third medication check. we will be entering the patient's room and doing the third medication check at the bedside. So, hello, Mr. Lantern, how are you? My name is Audrey, I'm going to be your nurse today. Before we get started, can you go ahead and show me your wristband and tell me your name and date of birth? All right, Mr. Lantern, 4/1/20, perfect. Okay, Mr. Lantern, before we start, do you have any allergies? You're allergic to pineapple and it gives you a rash. Okay, do you have any known drug allergies? No, you do not? Perfect. So we can go ahead and get started. I've washed my hands here, so I'm going to go ahead and put on some clean gloves. So, Mr. Lantern, I have checked all of your medications that your doctor has ordered, but I'm going to go ahead and check them here in your room so that we make sure that you know what he's ordered and that we can make sure we have the correct things drawn up. So first off, Mr. Lantern, your doctor has ordered hydrochlorothiazide in a 25 milligram tablet, and it expires on 6/23/2020. And I have here for you a hydrochlorothiazide tablet, 25 milligrams, and it expires 6/23/2020. Next, we have your lisinopril, a 20 milligram tablet, expires 5/26/2020. Here we have lisinopril, 20 milligram tablet, expires 5/26/2020. Next, he has ordered heparin, and we have heparin in a TB syringe here. He's ordered 5,000 units per milliliter subcutaneously, and it expires 8/12/2020. And we have heparin 5,000 units per milliliter, and we still have 1 milliliter in your syringe, so you are safe to go there. And it expires 8/12/2020, so you're good to go on your heparin. Next, we have hydromorphone, and we have that drawn up here. And we have 2 milligrams per milliliter to be given intramuscularly, expires 5/26/2020. And we have your hydromorphone, and we still have 1 milliliter in here, so we are safe to go with your hydromorphone, expires 5/26/2020. Next, we have your doctor's ordered a tuberculin skin test, and at 5 TU per 0.1 milliliter to be given intradermally, it expires 6/23/2020. And we still have 0.1 milliliters in here, so we are safe to go with your tuberculin skin test. All right, Mr. Lantern, before we start, I was going to tell you about each of these medications as we go. If you have any questions, then please feel free and ask. We're going to give you your first medication in your souffle cup here, and this is your hydrochlorothiazide. This is your water pill. Your doctor has ordered this because you are in today for hypertension, and your water pill will help increase your output, so you'll be peeing a lot more, which will then decrease your blood pressure. So that's why you're receiving this hydrochlorothiazide. We have checked your blood pressure already, and we have checked your calcium and potassium labs, and you're safe to receive these. But one thing that can happen when you're on this water pill is that you can become lightheaded or dizzy more easily. So we would ask that you rise in stages, which means you just get up slowly from your bed and stand up slowly. We wouldn't want you to fall or get hurt with that. And also that you'll have more urine output, so we'll just be keeping track of that and watching that for you. Next, so we'll go ahead and administer that. Here's your souffle cup. Go ahead and swallow. And can I go ahead and check your mouth, Mr. Lantern, just to make sure? Okay, perfect. We just want to make sure that you can swallow okay, and then you got that down all right. So that is good to go. Next, we have your lisinopril. This is also given by swallowing with some water. So for the lisinopril, you're receiving this as well for your high blood pressure. So with this, we have checked your heart rate and your pulse is currently at 90, and your blood pressure is 172/94. So what this lisinopril is going to do is help bring your blood pressure down, but because it can do that, it can sometimes bring it down a little too low, so we'll be rechecking your blood pressure. And again, like the hydrochlorothiazide, we want you to call if you need help, get up slowly, rise in stages, and we will reevaluate your blood pressure to see if this medication's helping. So I'll go ahead and give you that. If you can go ahead and take a big drink and swallow. I'll check your mouth really quick. Perfect. I'm glad that you can swallow that. Okay. All right, Mr. Lantern, next, your doctor has ordered heparin. He's ordered this because you're in the hospital and you're going to be laying flat for a little while. He wants to make sure that you don't get any blood clots in your legs. And so I've assessed your legs and they look good. They're the same size around on both legs. There's no redness or swelling. So I don't think you have any blood clots yet right now, which is a good sign. We're going to go ahead and give the heparin to make sure that blood clots don't form while you're in the hospital. With this one, it's really important that you let us know if you see any abnormal bruising. This can cause bruises on your skin, but it can also cause some bleeding or bruising internally. So the way we would know that you had any internal bleeding, you might be in the restroom and see black stools, black tarry stools. It would be really important that you tell a nurse right away if you had that, or if you noticed bruising anywhere on you. With the heparin, you can also bruise easily, so we're going to be really careful with that. So for the heparin, we have to give it in one of the 4 quadrants of the abdomen. And have you received heparin while you were in the hospital? Okay, not yet. So we're going to go ahead and give it in the right upper quadrant. And we've had our second nurse check here, so we are good to go with that. And what's important with heparin is once we give this subcutaneously, we don't want to rub it or massage it at all because it can cause a really large bruise called a hematoma. It's like a big knotty bruise. It can really be painful and dangerous. So once we give this, we're not going to be touching it at all, just let it rest. So we're going to go ahead, and because heparin is subcutaneous, we're going to take our alcohol swab and wipe off the area. And then we're going to pinch the area, and this can be given 45 to 90 degrees. So we're going to go ahead and do it like a dart into the area and then administer the heparin. Then we can release. We're not going to recap this. We would put it in the sharps container. All right, so for your next medication, Mr. Lantern, it's important for us to know what your pain level is at today. Is it still at an 8? Yes, okay. And is it, we have it here that it's throbbing and burning and that hasn't gone away. So because you're having this moderate to severe pain, your doctor has ordered some pretty strong pain medication. The hydromorphone can make you kind of drowsy. It can also make you a little bit dizzy. So it's really important that with the hydromorphone that you call for help before you get up. And so we're going to set a bed alarm for you just to remind you to stay in bed and to use your call light as needed. With the hydromorphone, it's going to be given intramuscularly, so we can massage it a little bit to help it feel better. We'll do that after we give this. And it's also, we're going to know that it's working for you. We're going to reassess in about 30 to 60 minutes to see if your pain level has come down a little bit. So because we're going to give it intramuscularly, we're going to give it in the ventral gluteal. So we would find your greater trochanter and we're going to go ahead and give it there. We could also give it intramuscularly in your deltoid, 2 to 3 fingers below the acromion process, or in the vastus lateralis on your thigh in the inner third of the vastus lateralis. But today we're going to give it in your ventral gluteal. So this is intramuscularly. We would swab the site of the ventral gluteal, and we are going to hold this taut, and we're going to give it at 90 degrees. We're going to aspirate for any blood. There's none, so we will go ahead and administer the hydromorphone. Okay, and then we will put this directly in the sharps. Okay, so now that we have the hydromorphone, there's one last thing that your doctor has ordered. He wants to go ahead and check a TB skin test for you. Have you ever had a positive TB skin test, Mr. Lantern? No? Okay, well your doctor wants to do one today because you've just recently come off chemotherapy and you're working at the homeless shelter, which is really great. So what we're gonna do, the tuberculin skin test, we can give it in 3 places. Here on your mid forearm, or just under your clavicle, or also on your back. And today we're gonna go ahead and give it on your mid forearm. What's important to know about the TB skin test is that you don't touch it or rub it. Make sure we don't scratch it at all. If you do any of those things, it can result in a false result of your tuberculin test. And so it's really important that if you are discharged from the hospital, that you follow up with your doctor so they can reread this test in 48 to 72 hours. If you're still in the hospital, we'll recheck that here. So that would mean you could get it checked as early as Friday at noon. So for the tuberculin skin test, we have our TB needle. We'll go ahead and swab the site with alcohol. And I'm gonna hold it taut and get down level. We're gonna do the bevel up. We're gonna go 10 to 15 degrees into the skin, just barely. And we will administer 0.1 milliliters slowly until we see the bubble. And then we're not going to touch it. We'll put this directly into the sharps container. So that is all of our medications and tests that have been prescribed for you. We're now going to complete your 6th right as a patient and document all of this into your MAR so that your doctor and other nurses will know that you've received these medications today at 0900, 9 o'clock this morning. So we will put all those in, put in the medications that you have been given, the time, the amount, and that will complete all of your patient's rights. Now, Mr. Lantern, like we talked about some of these safety issues, we want to make sure that you're safe in the hospital. So I'm going to go ahead and lower your bed to the lowest level, and we're going to lock the bed so it doesn't wobble around on you at all if you do get up. We're going to put 2 side rails up for you, and we are going to, here's your call light, we'll give that to you. And we also want to make sure that you're safe, especially from the hydromorphone. You could get dizzy or drowsy, so we're going to set a bed alarm to keep you safe. And please call if you need anything. Thank you so much, Mr. Lantern.